As a neurosurgeon, my most important job would be to access the brain. Now, with the skull covering the brain, any access that we attempt on the brain, we would have to deal with the skull. So, based on that, various types of openings that we create on the skull is something that I would be telling you today. The first and the simplest opening that we make would be a simple burr hole. So we primarily make a small hole in the skull. Now this would give us access to the extradural space, the subdural space, and we can even pass small needles and catheters into the brain through these small holes. We can have multiple burr holes also. So when certain ailments require multiple burr holes, we make that. And beyond that, if you want to go, we make multiple burr holes and join them together to make an opening called as a craniotomy. So craniotomy primarily means opening the cranium. So craniotomy. And this is one of the most common procedures that we do. Any brain tumor, if you want to remove, we do a craniotomy. If you want to remove a large clot in the brain, we do a craniotomy. So it is the most versatile procedure that would give us access to different parts of the brain. Apart from craniotomy, a similar procedure would be a trephine craniotomy or a trephination procedure, where we use a drill which is kind of circular. So the dimensions of the hole or the defect that we form on the cranium would be kind of fixed. But it's rarely used nowadays. So most of the procedures are done by a craniotomy rather than by a trephination. And finally, there is also a procedure called as craniectomy. So it's derived from the word craniotomy itself. But in a craniectomy, the difference being the bone defect is left behind the way it is. So if I do a craniotomy and do not replace the bone back into its space, it's called a craniectomy. And most of these craniectomies require a procedure where we have to fit that defect back with the bone itself, with an artificial bone, or with any other metallic mesh, usually a titanium mesh. But when we do a posterior fossa craniectomy, we usually do not put the bone back, and we can just leave it like that because of the fact that the muscle cover in the posterior fossa is kind of dense, so kind of protects the structures inside the skull better, even if there is a small defect. So small defects in the posterior fossa can be left behind the way it is in the form of a craniectomy and does not require a cranioplasty. So that is it about all the small procedures or all the ways we can access the brain. Thank you.